Welcome to the award winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in. Hello, everyone. I am here today with Dr. Shikha Jain, who is the founder and former president of the Women in Medicine 501c3 nonprofit. She currently now is the chair of the Women in Medicine Summit and also the board. Shikha, it is such a pleasure to get to talk with you today. What have you been up to since we last spoke?
Oh, I've been up to a lot of things. So the summit continues to grow, our nonprofit continues to grow. I'm still clinically practicing, so I'm still seeing my oncology patients. My kids are continuing to grow. So my husband and I joke that the nonprofit has become our fourth child. So I have three kids, and then I've got the summit and the nonprofit.
I love it. Well, I am so excited. I know that the Women in Medicine Summit is coming up September 18th through the 20th. This will be my third year attending. Cannot wait. It's always at the beautiful Drake Hotel in Chicago. What is different this year, your seventh year with the summit?
So we take feedback very seriously, and we also try to evolve with the life that we all live and the world in which we all continue to coexist. So this year, we've actually evolved in our seventh year. We are officially this year calling ourselves the Power of Women in Medicine Summit to showcase the power that comes with our collective voices. And for those of you who've attended in the past, we've always had two incredible days of leadership training and negotiation strategies and succeeding at your job, balancing work and life, wellness, kind of all the things that you don't get taught in your medical school career and things you don't get taught in your everyday life. And this year, because of what's going on nationally, we've added on a day of programming focused on women's health. And I want to emphasize that women's health goes beyond just the uterus. We have more organs than just a uterus. And so women's health includes everything from fertility and menopause and reproductive health, but we're also talking about substance abuse. We're also talking about ways that climate change is impacting women's health. So there's a lot of really interesting topics on the Thursday. And Stacey, you know very well, typically on the Thursday, we do a student conference as well for all of our fantastic student volunteers and the students who are presenting abstracts, posters, and oral abstracts. So this year on Thursday, we'll have our women's health track going on at the same time as the students track going on. So it's going to be a really, I think, powerful 3 days where we're focusing on the power of women's health, the power of women leaders, and the power of women's voices.
Well, I'll tell you, our Hear From Her listeners are very well versed that it is not just reproductive health, that women are not just tiny men, and that we do need to be treated. So I'm so thrilled that you're gonna be taking a whole day to really focus in on those aspects. Now, anyone you're particularly excited about hearing speak? I know you always bring out the powerhouses on your agenda.
Oh my gosh. It's so funny. Every year, it's so hard for me to pick because we have such phenomenal speakers. But I'm really excited this year for a couple people, mainly just to meet them in real life. So, Dr. Marcy Fogston, who, if you were watching the ESPYs, she got a shout out from the ESPY stage from Suni Lee, the USA Olympic champion gymnast. Because Dr. Faustin is one of the head physicians for the USA women's gymnastics team. So I'm really excited for her. Very excited. Dr. Mandy Cohen, the former director of the CDC, is going to be speaking, and she's doing a lot of advocacy work fighting misinformation. Really thrilled that she's joining us this year for the first time. We have Hillary Phelps, so sticking with the Olympics theme, Michael Phelps' sister. I did not know that she did a lot of work in the healthcare space, and so she's going to be speaking on a panel this year. Dr. Annie Andrews, a pediatrician who does a lot of advocacy work, is going to be speaking. Janet Fauci, who used to be a very, very big player and big name at Deloitte, uh, has a powerhouse talk that she is going to be giving. We have Debbie Hemmeter, who was one of the co-founders of Lean In with Sheryl Sandberg. And ironically, Sheryl Sandberg's brother is a neurosurgeon and he is going to be on a panel this year. So I honestly I could probably give you 10 or 20 other amazing faculty speakers. Dr. Bio Corey Winfield is coming back again this year. I mean, it's just I'm just excited to see everybody.
Mhm. Absolutely. I can't wait to hear all of those. Now, I want to shift gears. And, you had mentioned that one of the days is going to be focused on leadership. It's something that you have always put front and center. I remember the last two times I've been there, there's always been incredible women talking about leadership. Question for you: what do you see as the most critical leadership skill for women in medicine today?
So it's funny you ask because I got asked this relatively recently and I stumbled a little bit because I think that there's so many important leadership skills. It's hard to pick just one. But I think for women in particular, we really need to understand better how do we step into our power without apologizing for it. Because what's happened is society has typically taught women to, be seen and not heard, or girls are sugar made of sugar and spice and everything nice. And a lot of times when we're asking for things, we feel guilty, whether it's asking for more money, asking for a leadership title. Sometimes we feel like we're not deserving. Sometimes it still happens to me where I will ask for something that I'm like, oh, do I sound selfish or and do I sound greedy? And if you asked a man, I can tell you that they would be asking for 10 times what I would be asking and they wouldn't be thinking twice about it. So I think we really need to lean into this concept of how do we lead without feeling guilty about what we are asking for. And the way I've started framing things is when I'm asking for something, I will say, if I want to be set up for success, I want to exceed your expectations in whatever task it is I'm going to fulfill. In order to fulfill this task and exceed your expectations, these are the things that I will need to achieve success. And so that way, instead of making it sound like me, I really need this, this is for me, I think that by framing it as such that I want to succeed and I want to exceed your expectations, how can I do that? These are the tools that I need in order to do that. And it might be money, it might be an administrative assistant. It might be dedicated time. And I think also we need to give ourselves the opportunity to say no when our needs are not met. People often say go in knowing what are your absolute things that you must have that without you're going to walk away, what are the things that are negotiable, and what are the things that are pie in the sky. So having those three things kind of aligned in your mind when you go in to negotiate for something or when you're leading, whether, it might be I want to create this brand new cancer center, but these are my non-negotiables in order to build it and these are the things that we can probably, avoid if needed. I think those are some of the leadership styles for me that have been difficult for me to learn, but I'm learning as I grow.
I love that reframe of here's what I want to do for the greater group. Here's what I'm going to need in order to be successful so that we can all win. And I love how even though we were talking about leadership skills, it did shift over to negotiation, which I do think is another topic that has always been kind of front and center at the Women in Medicine Summit. I remember hearing a couple of folks talk about it last year, and I liked how you framed that up. Anything else with regard to negotiation that we should be looking for at this year's summit?
Well, and I will say, I think leadership and negotiation often go hand in hand because in order to be a good leader, you need to figure out what your stakeholders want, especially if you're asking for something like you're asking for a bigger budget or whatever you're asking for. You need to think, how am I going to frame this so the stakeholders I'm talking to buy into this and also are excited? So I think negotiation comes along with leading in an effective way. So we have some people speaking on negotiation again this year. Last year, one of our hottest sessions was how to negotiate like an auctioneer. I think people absolutely loved that session. So
I remember that one.
it was standing room only. So we definitely have some really good people speaking on how to negotiate for yourself, how to advocate for yourself, because sometimes it's not about just negotiating, it's also about standing up for yourself. And that becomes a part of the negotiation strategy.
Now, I did also see on the agenda there was a session building a doctor lawyer alliance. Is this something new or
Yeah.
different direction, or I guess the sign of the times?
It's a sign of the times. So, we as physicians probably engage with lawyers more than many of us would like. Many times there's malpractice, there's, um, you know, if you have your own practice, you need to have a lawyer involved when it comes to contracts and hiring and firing. But right now, in the current state, there's a lot of physicians who don't know if just carrying out regular medical care goes against the law. So I'm talking in cases where somebody is miscarrying. We've seen in the news where a woman miscarries and then she's arrested for having a miscarriage. And imagine how traumatizing that is to be a woman who wanted the pregnancy, who wanted a baby, miscarries, and then is arrested for a physiologic response that you have no control over. Physicians who are working, for example, in emergency rooms, family medicine physicians, OB-GYNs, who are dealing with situations where, let's say, a patient has an ectopic pregnancy where the pregnancy is not viable. There's some states where if it's past a certain number of weeks that this is discovered, the physicians don't actually know if they can legally save a patient's life. And that to me is baffling. And so we wanted to set the record straight because there's also a lot of misinformation out there and a lot of doctors, because we're not lawyers, we don't know whether it's safe. And because there's a lot of polarizing rhetoric coming across the airwaves, whether it's through social media or the news networks, it's really important that physicians know what they can and cannot do. And in most cases, we can still save lives. We should still be putting the patient first. But the question becomes, how do you navigate that and still protect your medical license and protect yourself? And so we wanted to make sure we had something focused on a physician, lawyer talking about this and what can you do in those situations. And then also, more than that, hopefully you never end up in a situation like that. But if you do, we wanted to have resources available. And Stacey, as you know, I'm not about complaining. We don't come together just to complain about the problem. We also want solutions. So hopefully you'll be able to get resources where, God forbid, if you're ever in a situation where you're faced with this question, we have lawyers that we can connect you with.
Mhm. Oh, that is amazing. It leads me to, I think one of the most valuable things I experienced attending the last 2 years wasn't just the sessions. I absolutely love the sessions, but I absolutely got so much out of the networking. Those side, hallway conversations, you're in the lunch line. That's what I'm looking most forward to. I have never been, and I remember saying this when I came back, I was talking to my mom about it. I said, "I don't think I have been around so many powerful, incredible women all in one spot. And you've done this. I mean, I know this is the 7th year. I love the story of how you started this way back when, and it was just like a half day session.
It was so the very first symposium I did pre-summit was a 1 day, yeah, one half day, and it was an institution focused program, but we ended up with 100 people outside of the institution coming because they heard about it and showed up. Then our first summit in 2019 was 2 full days with the half day student pre-conference, and we had 450 people show up. And it has just grown ever since, and it makes my heart sing to see the people in the room. I mean, no matter how exhausted I am at the end of the conference, it blows my mind, these powerhouse people. And not only that, there's the powerhouses who are already in leadership, and then there's the powerhouses who are like up and coming. And that to me is the coolest. If you notice, when you look at our speaker agenda, we often have speakers who you don't typically see at all of the medical conferences. And I do that intentionally. We have a really good mix of people who are well known and very well respected, and also people who you may not know of yet. But I can tell you a lot of women who've spoken at the summit have ended up blossoming after. And that makes me so happy because we want to lift up the next generation as well.
Mhm. And you'll hear at the beginning of this podcast, we always say, lift as you rise. And I got that from attending your conference because that is the true. As women are coming up, we need to be there to sponsor, to coach, to mentor. And actually, for those people who are listening who may not be that clear on the difference between a sponsor and a mentor, could you talk a little bit about that?
Absolutely. So they are definite differences, but you can be a mentor and a sponsor. And we actually published on this a couple of years ago with myself and Dr. Ruth Goshen part on this mentor sponsor continuum. So a mentor is somebody who guides you, helps you, gives you advice. A sponsor is someone who says your name when you're not in the room. So a sponsor is someone who says, "Oh, this leadership opportunity would be great for Stacy. I'm nominating Stacy for this opportunity," or Stacy, you should speak at this conference. I'm going to put your name in the hat.
You're voluntold.
Exactly, you're voluntold to do something that's gonna be great for your career. And then a mentor is somebody who, once you get an opportunity like that, helps you be successful in that opportunity. So I actually one of my original mentor sponsors is my dad. I talk about him all the time.
He's also your photographer. For any of you who have attended or who are going to be there, you might see Shika's dad with a camera. He's fantastic.
He's a photographer. He's like in everything. He's my research mentor. He's fabulous. So the best story I have is my husband and I were dating at the time, and we both were doing work in my dad's office. We were dating, and it was early in the relationship. We both got paired up to work in his office to do research, and my dad had both of us submit an abstract to a national surgery conference, and they both got accepted. And we were the first medical students to ever be presenting at this surgery conference. They hadn't really had med students present before us. And so after we, my dad sponsored us to submit this abstract and made us both first authors on either on these two papers. He then mentored us. So he had us run our slides, he had us review our slides, he had us present to him. So you can be somebody who suggests somebody for an opportunity. And then when they get that opportunity, you can mentor them to be successful in that opportunity.
And I just love that concept. So, as we're going to close up our conversation, two questions for you. First of all, knowing where women in medicine has been, what does the future look like for you? I mean, I'm assuming this isn't going away.
You know, if you had told me 10 years ago I was going to start this, I would have laughed. Now, 7 years in, I was hopeful we'd be further along now than we are. I think that unfortunately, the need for this organization is going to be even more as we move forward and navigate these current waters that we are navigating in the healthcare space. I think that we were starting to make strides in moving forward, and we're starting to see a lot of those strides kind of cut at the knees because of decisions that are being made on where money is being invested, on the fact that the word women has even become taboo and we can't even say that something is focused on women. I think that we have a lot of work to do. And I'm optimistic because, we've seen things ebb and flow and things come in cycles. So I'm cautiously optimistic as an oncologist. But I don't think, unfortunately, the need for our type of organization is going to decrease. I think it's going to increase. And I think the desire for more and more opportunities to come together in this safe space with people that you can communicate with and dialogue with, even if you disagree. You may politically disagree, but we all care about people's health. We all want to help people be healthy and stay healthy. And how do we do that? Whether it's from the workforce standpoint, where women need to stay in leadership and advance into leadership because we know it improves patient outcomes, both in surgery and in internal medicine. Whether it's we know that institutions that have women leaders have higher retention rates, have great Press Ganey scores, they get more awards. Whether we know that keeping women in healthcare directly positively impacts women's health, the need for all of this work at the workforce level, at the women's health level, it's all desperately needed. So I foresee that our organization will continue to grow. And I hope beyond hope that the need for us by the time my children are either practicing medicine or lawyers or artists or whatever they decide to do in their lives, I hope that the need for this organization pivots into something else because I would love to say that we've been able to actually address these gender inequities and start to see some real change in the healthcare space.
Well, I just have to say thank you because it's such a pleasure talking with you, and your commitment to women in medicine, to the summit, to I've seen you interact with folks at the luncheons, off the stage, in the hallway. It's truly commendable. And we can't duplicate you. We need more of you. But I'm just going to say personally, if you're out there and you're listening and you're even curious about the Women in Medicine Summit, check it out. It's September 18th through the 20th in Chicago. I will tell you from my own personal experience, it's life-changing. The contacts you make, the content you are going to hear, you will leave a changed person. So, any last parting words from you, Shika?
Right now in healthcare and in the world, a lot of times it feels like everything is on fire all at once. And I know a lot of people are getting very disillusioned and very frustrated and scared. and burnt out. So, my one message to anyone listening, if you take anything away from this, is there are a lot of us out here who are feeling similar, and we go through these cycles where someday we're feeling like the world is ending and we can't do anything. I'm here to tell you there are enough of us who are trying to drive change, who really care, and we are there. We are there for you. We are a community, and we really are, as our hashtag says, WIN stronger together. So if you're feeling burnt out, if you're feeling hopeless, if you're trying to find a way to just connect with other people or talk about what's going on or think of strategies for how you can improve things or just looking for a way to improve your own life or have a fun weekend. Honestly, it's really a fun weekend. Please come to the summit. We would welcome you with open arms. We would love to meet you and see you there. I promise it's not a boring conference.
No, I can second that.
I only plan things that I wanna go to, and I have 3 little kids, so I don't plan things that are boring because I will not show up if it's boring. So, we would love to see you in September in Chicago. You can always reach out to us. If you can't make it in September, please reach out. There's lots of ways to get involved with the nonprofit, and we are really driving change, and we're appreciative for collaborations like this with Medscape and with Stacy, and hopefully you can get the message out there that there's a lot of us out there driving change, so let's work together to really improve our healthcare systems at a national level.
Absolutely. Well, I will see you in September, and I hope to see a lot of our listeners there as well. Thank you again, Dr. Jane. I so appreciate your time. And yep, we're going to lift as we rise for sure.
Thanks for having me.
You got it. Take care. To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.